Hi everyone, today we are going to discuss about differences between composite veneers and porcelain veneers and things you need to consider while you're providing or treatment planning for those veneers. So let's look at this case. This patient came to me, she was very young, 28-year-old, came to see me because she was having sensitivity with her two central incisors. She had issue with fizzy drinks and she used to drink a lot of fizzy drinks, and because of that she has eroded a lot of her teeth. So this patient needed full mouth reconstruction, adhesive technique, and I placed 2 implants on the 5 area because she has congenitally missing teeth. But let's concentrate on those centrals. The rest of the teeth, she just needed edge bonding. So what we did was we did whitening and provided patient with some edge bonding on all the teeth, apart from centrals, because they were quite sensitive, and we decided to bulk them up a little bit facially. So centrals were done using direct veneers, and this is composite veneer. I felt that she was young, and for maintenance and everything, I felt that the composite may be the best treatment at this point in time in her life, and maybe in future she might want to change it to porcelain veneers. With regards to composite veneers, the advantage is that you are in control. You can build them up as the way you like it. You can shade them, the shade and everything as well. So, patient looks at it there and then, and you can change it. If they chip or break, it's easy to repair. Arguably less invasive than porcelain veneers. And I say arguably because most of the time you're doing porcelain veneers because A, the tooth is damaged, or patients lost a lot of tooth tissue and you're restoring the missing tooth tissue. So unless you're doing it purely for cosmetic reason, where patient wants change of smile or crowded teeth, and you're doing veneers, which I personally wouldn't do, but those are the time when patient needs a lot of tooth preparation. But if patient has heavily filled tooth, or you are adding tooth tissue because patients lost tooth because of the tooth wear, then porcelain veneer does not need to be invasive. You can really create a very fine margin and give patient nice feldspathic porcelain, which can be really thin, or you can even have Emax porcelain, which can be also really nice and thin and looking good without damaging too much of the tooth tissue. Of course, composite veneers are cheaper, and that's another reason why patients they lean more towards composite veneers. However, in my opinion, long-term maintenance of composite veneers and the cost of that would be equivalent to a porcelain veneer. So I have a chat with my patient that, if they are choosing composite veneer just because of the cost, then I always tell them that, look, in a long run, they both will cost you the same, because porcelain veneer will stay like that for long term, for longer time, whereas the composite veneer will start deteriorating, and you will start getting some staining, some chipping, depending on your diet. Because I have seen that if I'm doing composite veneer for 2 different patients, same thing, easy veneers, one patient will stain their composite quicker than the other patient, and I feel that a lot of that to do with hygiene and diet of the patient, and that's something you are not in control of. Obviously you can educate them, but you can't really brush their teeth. So you need to be realistic and let patient know and have a realistic expectation. So the disadvantage are, as we discussed, chipping, staining, and depending on patient's habit, it can be more aggressive, more quicker, or the veneers can last, I've seen some of my patients even 7 years after, apart from a little bit dulling of the veneer, which the composite dulls down, there is no staining. Patients maintained it really well. And that's something, it's our job to educate patient about the quality and the differences between composite and porcelain veneers. So with regards to porcelain veneers, this is the case where patient had spacing and patient wanted to close the space. So the ortho treatment was carried out, and then I did the veneer for this patient. And you can see that the result looks good, and I can guarantee almost, which I don't to the patient, but I mean to myself, that this result's going to be like this for many years to come, and it's not going to change. With regards to bonding porcelain, I again use the same protocol as my onlay bonding protocol. So I would use restorative heated composite to bond my porcelain. And at some point in some of the videos, I will discuss my bonding protocol of veneers, because it's very important to understand how to bond veneers properly. So I'll use heated restorative composite to bond veneers. And if your technique is correct, then they do last really long time and give really good aesthetic results. So in my opinion, if patient needs veneer and it's additive veneer, which means you are adding something to patient's existing teeth, then porcelain veneer is a choice of treatment, because it requires less maintenance, much more predictable if you have a good technician, and in a long run it will cost same as composite veneers. I will not do composite veneer because it's cheaper. And if I'm giving patient two options and patient selecting composite veneer because it's cheaper, I will make a point to that patient that in a long run, they will end up spending same amount of money if they're doing porcelain veneer or composite veneer. Having said that, yes, if patient wants composite veneer, I will do composite veneer and I will do my best. But the fact that many people think that composite veneers are reversible, which they are not. You cannot remove all the composite veneer without damaging the tooth. So they are definitely not reversible treatment. They are definitely less invasive sometimes, but as I said before, if you're adding something, if you're doing additive treatment, then porcelain veneer and composite veneer, invasiveness wise, there is not much difference. With regards to doing actual treatment, make sure that you have done diagnostic wax up and tried that wax up in patient's mouth as a mock-up, and let patient go for maybe a week or more to test it out, because many times patient may get disappointed if they don't know what they are getting. So especially when you're doing veneers, most of the time it's done for cosmetic reasons. You need to make sure you have done diagnostic wax up and done a mock-up on patient's mouth and showed them how they will look when you finish doing the treatment. So make sure you've done the mock-up stage and diagnostic wax up. So I hope you found this short lecture very useful. If you have, please share with your friends or colleagues. If you have any question, contact me on social media or go to my website www.drdevangpatil.com. In the next video, we are going to discuss about porcelain veneers and different techniques and different design of preparation of porcelain veneers.